their season too. All right, guys. Well, I'm going to go ahead and get started. Um, thank you again for joining us for the Harry Barnes virtual grand rounds. This month we have Dr. Jeffrey Steiner. I've been trying to get him to do this talk for about 2 years now. And actually it's a really good talk. And it's, a lot of us are involved with, well, a lot of you are involved with side ventures, side businesses. And obviously that can get us into, that could be very rewarding, but there are potential hazards on the road. And so Dr. Steiner is going to talk about those things. He's a pediatric otolaryngologist, he's a pediatric anesthesiologist here in Dallas, Texas, and an associate professor of anesthesia at UT Southwestern Medical Center. He completed his medical school at UNT Health Science Center and Texas College of Osteopathic Medicine. He did his residency at UT Southwestern. And then he's also gotten his MBA from UT Dallas School of Management. He's the director of he was the program director for the Pediatric Anesthesiology Fellowship, and transitioned into director of clinical operations for basically the largest anesthesia group at Children's, probably, would you say North Texas Pediatric Anesthesia Group?
We're probably there. Yeah. I mean, we're now some of the PEDS groups are kind of wrapped or folded into like an adult group, but as far as PEDS only, our division's pretty big.
Okay. All right. I'm gonna let you take it away. Thank you, Dr. Steiner.
Absolutely. Thank you for having me. I am first time to use a Mac to do this, so this ought to be interesting. I am going to share my screen. I can do it this way. There we go. All right. Can y'all see my screen?
Yes, we can.
Perfect. So thank you again for having me. I really appreciate the opportunity. This is a fun topic for me to talk about. As far as my disclosures go, I have a professional disclosure, and that's this. This is for educational and entertainment purposes only. I'm not giving legal, accounting, or coaching advice. My opinions and views are only mine and mine alone, and don't necessarily represent UT Southwestern, Children's Medical Center, or the Harry Barnes Medical Society. So as far as a financial disclosure, I'm the author and publisher at Anesthesia Made Easy and Physician Life Management. And I've written some books. I'm not going to sell you guys any books, don't worry. I know I'm speaking with otolaryngologists. So learning objectives. So at the end of this talk, participants will be able to recognize the documents, will define current employment. You'll be able to discuss the legality of non-compete clauses, ethics conflicts with side hustle, classify the different types of hobbies, which sounds a little weird, but we'll get into it. It'll make sense, I promise. And then we're going to organize a plan for your own side hustle. So why me? Why can you trust me? I'll give you a little bit of background about myself and what I've learned along the way. And when I was a resident, I did some moonlighting as a resident. And then as an attending, I have a side hustle, which is that publishing business that I mentioned. And so as I started doing the side hustle, I noticed the Bader-Meinhof phenomenon, and that's this. It's called the illusion, the frequency illusion, where you see a Tesla, or you're thinking about get a Tesla, and then you see Teslas everywhere you go. You start recognizing them. And I find like that is very similar to side hustles. Once I started getting interested in doing side hustles, it seems like I see them a lot more. I heard about them. People would tell me about them. So I'm bringing some stories to kind of illustrate my points as we go along, to really help this be a good guide and resource for you all going forward. So why this talk? In medicine, we have, we go through residency, we go through training. Some of us have done fellowships, some of you all have done fellowships. And we don't talk a lot about side hustle. We're so busy in the operating room, getting cases done. And really, as I've gone through and I found out about people that have been doing these, I find out they run into contract disputes. People have had issues with their medical license, and people have ended up in losing their license in federal prison. So I think this talk is a way to bring side hustle to the forefront. We all hear about how great they are, but let's kind of walk through like a couple things that can kind of get us into trouble. First off, what is a side hustle? So a side hustle, I'll define it like this. A day job is kind of what you do as a physician day in and day out. And a side hustle is kind of what you do on the side. Old school, we used to call it moonlighting, but I don't think moonlighting really encapsulates what side hustles are today, because a lot of physicians don't just moonlight in their specialty, they kind of do other businesses and things. And so the way I think of it for physicians is like this. You have physician kind of moonlighting side hustle, right? Internal moonlighting, external. We'll kind of talk about those two. Then you have like non-physician kind of side hustles, which are like real estate, or some physicians may do a microbrewery or play music and sell it, but it has nothing to do with being a physician. And then you have people that kind of have a combination of both, and that may be like a blogger, an author, maybe even a physician coach. But because we are physicians, we have another level of side hustle that we can do that's pretty cool, and some opportunities that are available to us. And so before you side hustle, you really need to think about protecting your assets. And when I bring up the word assets, most people think about a big house, maybe cars, maybe even a 401k. But I'd like you to rethink your definition of assets, in that your most important asset is your friends and family. And you don't want to lose time with them when you're doing your side hustle. You also want to think about your medical license. Your biggest asset that you own, that you have, is your ability to earn money as a physician. And you want to think, if you're intending, you want to think about your job. You want to protect your job. And if you're a resident, you want to protect your residency. Because as a resident, you're kind of a full-time student and a full-time employee, and balancing those can be challenging. So know your boundaries. Let's build some boundaries. And I know that you don't want to hear about the limitations of your job, how it could impact you doing or not doing a side hustle, but let's learn about your boundaries. So let's talk about employment and training. In your job, what dictates the boundaries as far as what you can do away from the job depends on your contract, and it depends on the institutional policy. So your contract, do you even know what was in your contract? Most people signed it years ago, or they sign an annual update. You really don't know exactly what's in it. And it could be different depending on state, institution, and it could be employer specific. A lot of physicians have in their contract a non-compete clause. Now, if you go online and read about non-compete clauses, you'll see all kinds of things. You'll see, oh, they're illegal, you can't have them, it's restraint of trade. But the problem is, you can debate whether you think it's enforceable or not. It's in your contract. And so if it's in your contract and you want out of it, you are going to have to pay a lawyer to kind of help you get out of it, even if people on the internet are saying that it's illegal. But what is competing? Is competing practicing medicine? Is it bringing your patients with you? What type of medicine? If you work as an otolaryngologist, is the non-compete also cover you covering an urgent care center or a sports clinic for doing H&Ps for sports physicals? What exactly does it cover? And then the other thing is the employment policy. So what does your employer say about outside employment, be it expert witness, case review, moonlighting? I know at our institution, if you do a case witness, it goes through the university. There are very strict rules about how you participate in that. The institution does take a cut of that, of the money that you earn on that, because they say that you were, you got the job because you worked at the institution. And so you'll have to kind of see what that outside employment looks like and how they define it. What about outside business? Can you run a clinic or a spa? We'll talk a little bit about that. What does the employment policy say to that? Intellectual property rights. You'll have to dig into intellectual property rights. For example, our institution could care less about my books on Amazon, but by golly, if I had a medical device or a patent, they would be all over it. So you really have to dig into the policies to see what's important to your institution and how that would impact a potential side hustle. And you could say, well, what's the worst thing that could happen? And true story time, there was an OMFS attending who was working at our institution. He had started to do expert witness. So in the expert witness disclosure, he said what his salary was. And when they came back and said, well, wait a second, your salary at your university doesn't match the salary that you say that you're earning. And turns out he was running a dental clinic on the side that the institution didn't know about. And this had been going on for 10 years. And when they calculated up, the university said, great, we're great that you ran that dental clinic. We need a cut of that money that you were earning from that dental clinic, which amounted to $1 million. So even if you say, well, maybe I could skate by a year or two, if they find out, they could go and claw back all the earnings that you made if you didn't get approval for that outside employment. So what about fellowship and residency training? What does the 80-hour work week include? It includes clinical education work, all moonlighting, but does it include a side hustle? So that's where you have to kind of dig into the training, because the last thing you want to do is jeopardize your training. If you read moonlighting, this is from the ACGME Common Program Requirements. It can't interfere, moonlighting can't interfere with your residency training. And PGY1 residents are not permitted to moonlight. Now, how do they define moonlighting? It's kind of interesting. Voluntary, compensated, medically related work. And then they even say external moonlighting, medically related work, internal moonlighting, medically related work. So it's interesting from the ACGME perspective. If it's not medically related, it doesn't count in the moonlighting policy. Now, remember, as residents, you may have an employer and you may have a GME office. They may not be the same institution, so you still may have to get approval for outside employment. There was some joke going around in Twitter for a while of how much McDonald's was paying. And there was a joke that, like, oh my gosh, it's more than a resident makes, and maybe residents are going to start moonlighting at McDonald's if we don't watch out. So if you're going to do a side hustle, probably best to disclose especially if you start making some really tangible funds from it, so you don't get in trouble. What about protecting your medical license? We're going to kind of hone in on the internal and external moonlighting. Let's talk about that a little bit. Internal moonlighting, that's where you work at the institution that you do your day job. It could be extra shifts, it could be extra work days. Sometimes some residencies do some moonlighting for residents where they hold a pager overnight for airway call or something like that. And depending on the compensation in the institution, some places actually compensate for academic work and administrative work. And I know a lot of people are like, yeah, I want to work there. But there are some places that will compensate attendings based on abstracts, papers published, those kind of things. And then when you moonlight, you'll want to find out, are you getting paid in your W-2 or are you getting paid as a 1099? Now, what's the difference between the two? W-2 taxes are taken out of the paycheck. In a W-2, I'm sorry, in a 1099, they are not. So you get a check for $2,000 from that moonlighting, you will have to pay the taxes on that, even though it was internal moonlighting. So just be aware of that. External moonlighting, you'll want, most places you'll need a full state medical license, and some states require specialty licensing. Like in Texas, they have office-based anesthesia, sedation, offline medical direction, telemedicine. You actually need an extra license for those things in the state of Texas, for example. Also, your medical malpractice insurance. You want to make sure that you are protected, especially if you're doing external moonlighting. And you need special covers to special writers to cover you, such as doing medical direction. So who are you working for? This comes to another true story event. There was a resident working at an institution here in Dallas, and he found a great moonlighting gig down in Houston. The company wanted him to come down on the weekends and do HMPs for a clinic. They would fly him down. He would do the HMPs. They would fly him back home. He made a lot of money, and they even paid for the flight to and from. So happened was several years into this, the feds come knocking on his program director's door, finds out that he was doing HMPs for a pill mill down in Houston for an Armenian mob. And so he lost his job, lost his medical license. He actually spent some time in a federal penitentiary and was released early, kind of when COVID hit, because they're trying to get people out of the penitentiary. So I've had his permission to tell this story because he wants other people to be aware that you really got to know who you're working for and what you're doing. So what about healthcare and spas, gyms, cryotherapy, laser treatment? It's kind of interesting because it seems like, well, it's easy money. I just lend my medical direction to them and I just get a paycheck for being a medical director. The problem is at the laser hair removal place and tattoo removal, a lot of times people are giving topical anesthetics to help with the pain control during this. And of course, we're back to another true story. So there was a health spa that a medical director was covering. He had his name on it, was getting paid by the medical spa to be the medical director. The client came in, checked in at the front desk. The front desk receptionist, who had no medical training, gave her the topical lidocaine. The patient went in a back room, was really worried about having pain from the laser hair removal, put plenty of lidocaine on, and put so much on that she actually ended up having a seizure and died of lidocaine toxicity. And so here, this medical director, I've taken his name out, but he was 38 years old when this happened. Not only did a patient lose their life, but also he very well probably lost his medical license over this. So just be aware of the type of jobs that you're lending your medical license to in hopes of, kind of running a side hustle. So what about protecting your relationships? So with friends and family, side hustles are going to take time, and that's time that's going to be away from your work, away from your job, and also kind of time away from your family. So, in this effort to run this side hustle, you don't want to waste or use all your time in such a way that you become alienated from your family, because they're some of the most important assets that you have. And just kind of keep that in mind, because I've seen some people kind of burn themselves out trying to chase a side hustle and really miss out on time with their family. So how do you find your side hustle? And then why a physician side hustle, right? So this is Captain Obvious making it rain. Money makes it real easy, answer to that question, like why? Yeah, I want more money, but is it really about the money? So what I would like you to do is find your why. So there's a book called Start With Why, fantastic book, and they talk about this, kind of the three circles. The outside circle that everyone sees is the what. The middle circle is the how, and the core of the question is the why. So what I would propose is start by finding your why, and then figure out what you want to do. And then the cool thing is finding the how. And you may not even know how yet, and that's something that you have to kind of learn. And that's some of the fun of doing entrepreneurship, is figuring out the how as you go along. So what about the money? If you're if your why is about making more money, I would suggest you first try and optimize your finances. Are you getting a retirement match? Are you using a budget? Um, you know, why do you need the extra cash flow? And do you have a spending problem? Because if there's a spending problem in your budget, no amount of money that you introduce into that system will be able to make up for it. So not only do you have a spending problem now, you just kind of added some accelerant to it, and now it's just going to become worse. And now you're spending more time away from work and your family and this kind of thing. And it's really about just trying to optimize your finances first. So a lot of people I find are trying to kind of like run away from their job with a side hustle. Like, I need an escape, I'm getting burned out. But really, are there things in your job that you can do to optimize your job so you don't necessarily have to have a side hustle? So are there things with your schedule? Are there projects that you want to work on? You know, is the itch that you're feeling to scratch really about a side hustle, or is it about finding an interesting project? And you may be able to meet those whys with the job you already have and not complicate things by having the side hustle. And sometimes you need a not to-do list. Instead of a to-do list, like, what are some things that you're doing in your job right now that you don't want to do that you could have someone else do, or projects you could hand off so that you can do the things that really bring you joy. So kind of look at the whys, and if there's things in your job that you shouldn't be doing. And sometimes it is about the money. So when I was a resident, I had our first son on the way. My wife, at the time, we were dinks, double income, no kids. And we knew that we wanted my wife to come home and be full-time with our kids. I was starting fellowship, so I knew I had another year of training to go. And with our budget, I knew we were going to be $700 a month short for the next year. So I started working for a Southwest Transplant Alliance, which is an organization that helps with organ procurement. So you would get a phone call. The way the system worked, they had a coordinator that when organ donation was needed, they would coordinate everybody, all the surgeons, they would place all the organs, they would find anesthesiologists. Well, at the time, they were using residents, and they had a list of residents. And they would just start at the list and work their way down. Well, I figured out, like, if I answered the phone every time they called and said, look, I will either do the organ harvest anesthesia, or I will find someone for you, then I always got the first phone call. So I was answering my phone on weekends, 2 o'clock in the morning, to fly out at 4 o'clock in the morning. And I hustled because I had, my why was to be able to have my wife come home and be with our son. And that was a pretty strong why for me. So I knew how much I needed to earn. It was about $88,400 to kind of tide us through. And I busted it and really made it happen. So sometimes it can be about the money for a short period of time. I got a lot of, it was an interesting side hustle, interesting moonlighting, really enjoyed it, met some great people, helped out patients, and had some pretty cool experiences. So where do you get started with a side hustle? So I would start with the hobbies. And there are really 3 types of hobbies. There are hobbies that are free, there are hobbies that cost money, and there are hobbies that make money. Is there a hobby that you already engage in right now that you're like, you know, I really enjoy doing this, I could continue to do this, and kind of make money at it? So take a look at your hobbies. Are there some hobbies that you can use to make money? Because if you already know a skill, and it doesn't even have to be medically related, but if you have that skill, people may be willing to have you help them attain the same skill as well. And so if you already have it as a hobby, why not turn it to make some money from it? So the other thing that I would suggest is look for the money plus. So the money plus is this: money plus autonomy, creativity, streams of income, lifelong learning fun. If you make it more about just money, then the side hustle will mean a lot more to you. The thing that I would caution is this: when you start looking at a side hustles, a lot of physicians will see a side hustle and say, well, it only earns that much money or this much money. And they're really looking at it from the financial standpoint. Now, there's a concept in economics called financial anchoring, and it's this. When you get used to a financial anchor, it will determine what you will think is expensive or what you think is an appropriate price for something. For example, if you go to Starbucks regularly, you'll think $5 for a cup of coffee is not a big deal. Whereas Dr. Johnson and I kind of remember a time when coffee was probably 25 cents at the local diner. So, the anchoring of how much a cup of coffee should cost is going to be very different depending on where you get your coffee. And the same thing for side hustles. So you may find a side hustle that you enjoy and you're like, well, but it doesn't earn physician money. And that's okay. When I first started with the publishing business, the money that I would earn after selling a couple books on Amazon in a month is like, 20, 30 bucks. In the grand scheme of like physician money, that's like nothing, right? But I got more joy out of that 20 and 30 bucks from the side hustle than I ever got from, once you got used to kind of the big attending paycheck, right? Same thing for doing affiliate marketing. When I first earned my 80 cents in affiliate marketing, it took me like 4 months to get there. It was crazy how much joy I got from that. And I can't explain it. I've talked with other side hustlers as well. So enjoy the small wins. So preparing. So I want to kind of help prepare you guys for side hustle success. And that's this. There's kind of an emotional cycle of side hustle. And there's kind of a line. So on the top part of the line, we see optimism. On the bottom part of the line, we see the pessimism. And when you first start out, you have uninformed optimism, right? You're like, oh my gosh, I've got this side hustle I'm going to do. This is going to be great. Well, then you start learning about all the how of how to get to the what. And you kind of get pessimistic. So you start learning stuff. You're like, oh man, this isn't going to work. I didn't think about this thing and that thing. And then you're eventually going to get down to the valley of despair. And the problem is when you hit the valley of despair, you're grinding away and you don't feel like you're making any headway. And then you get to a point where you say, you know what, I'm just going to give up. I'm going to try something else. So instead of trying something else, if you really have a passion for the side hustle you're doing, instead of giving up, realize that you're going to go to the valley of despair. And if you push a little harder, you're going to get back to informed optimism and then success. The problem is a lot of people, when they hit the valley of despair, they just give up and then they try something else instead of pushing through it. There's a book called The Dip where it kind of talks about this. So just be aware of the emotional side of side hustling. The other thing that I'd like you all to kind of think about is when you start side hustling, you will get, if you talk with some people, you may get a little bit of people kind of downplaying what you're doing, right? And it kind of feels like, well, isn't that cute? That's cute. That's like, someone's paper route. Oh, isn't that cute side hustle? Oh, good for you. Yeah, good for you. It's very much a not a supportive role. But once you start getting successful, it turns from, oh, isn't that cute, to, well, a bucket full of crabs. And what is a bucket full of crabs? With a bucket full of crabs, when one crab starts trying to climb out of the bucket, the other crabs will reach up and pull that crab back down. And why does that happen? We see that happening with physicians a lot. Someone starts a side hustle and the other physicians around you don't understand it. They have inflexible expectations of what a doctor does. Like, well, a doctor doesn't sell books or jewelry or they don't do that. That's not what doctors do. The other thing is it kind of destroys their own concept of what a physician is and what physicians do. It also, there's a competition. They feel inadequate. Maybe it's envy, like, well, you can't have that because I don't get that. And then also some of them have tried these side hustles and it didn't work, and they feel like that it shouldn't work for anybody. And so, of course, true story time. I'll tell you a story, a tale actually of two residents. So there are two residents, two different programs, and they each had a side hustle, and they did very well. Both these residents worked hard in residency. They did well on the in-training exam. They never had any complaints from their faculty. They were always on time, always stayed late, got everything done, were model residents. And then their side hustles did really well. One of the residents bought a Rolex, not as a flex, just something he had always wanted, a Rolex. And another resident bought a house in a very expensive part of town as a kind of investment property. And so when it became known around residency that these residents had this, all of a sudden it changed. And it wasn't, these are great residents. It was, well, these residents really aren't, they aren't serious about being a doctor, because look, this guy is making so much money, he bought a Rolex, and this one's making so much money that he bought a house. They're not serious about being a doctor. I really don't think they should be doing a side hustle. So it's interesting how things changed. The story behind it changed. And so it makes it a little bit of a challenge, right? When you try and share with other physicians kind of what you're doing in the side hustle. So I would propose advice for success. First rule of side hustle: don't talk about your side hustle. You may not be able to talk about it at work. But really, the second rule of side hustle is you really got to find others who are doing a side hustle to support you, because they're going to understand. They're going to get it. And that may be like a mastermind group. That might be other people on a Facebook group. But you've got to find someone else to help you as you go through, to kind of share your successes, your failures, those kind of things. And at the very least, if you're making all that money, sometimes you just got to dry your own tears with the gobs of money you're going to earn in your side business and just kind of move on. So some of you might have been doing a really good job at listening to my talk. Others of you might have already been on the internet trying to find your own side hustle. So why don't we do a quick review of the talk, and then give us some time to discuss and talk together about side hustles. So we talked about what a physician side hustle was. We talked about protecting your job, both with your contract and looking at policies, and also the non-compete clause. We went on to talk about protecting your residency, training, and employment, and how that could run awry. Talked about your most important asset, your friends and family, and making time for them in this quest to run your day job and your side hustle. We talked about protecting your license. Make sure you know who you work for, and also make sure you know some of the challenges and risks that you may have when it just seems like it's something easy to do to make some money. So also start with your why. Why are you going to side hustle? And then figure out the what, and then figure out the how. Finding out the how is kind of the fun part of it. You won't know everything, and that's okay. So look for your money plus. It has to be more about money. It has to be about learning a new skill, something else to help you keep going. Because with the physician anchoring of how much money people make and what it feels like, you're going to need something plus the money to kind of keep you going forward. We talked about the emotional cycle of the side hustle and the valley of despair and working your way through that. Talked about, the paper boy versus the bucket of crabs. and finding a group to kind of help support you as you go through. And so thank you very much for your time. I'd like to open it up with Dr. Johnson for some questions, and see what you guys think. Am I on? Am I off?
Yeah, you're good.
What are your thoughts?
Hey, that was outstanding. Thank you. It's funny. I've had the side hustle itch. I guess started about 5 years ago. It's like, oh man, it was kind of money. Like, yeah, I would
Yeah.
like to earn some extra money, but it was also, I wanted to do something else. Like, I felt like
Yeah.
getting up, going to the operating room, taking out tonsils and adenoids and doing DLBs and airway reconstruction. It's just like, okay, I need another way to make money so I don't have to constantly be in the ICU,
Yeah.
talking to families with sick kids. And so
Yeah.
I started applying for jobs. Like, usually like a job will come up, say for like the board, they would ask for an assistant director to the board. So I'd apply for that job. And then of course that works. I kind of did internal, external, but sort of related to the medical field, because I'm not
Mhm.
as creative as you. And I've been fortunate, like I was able to eventually get hired as an editor in chief. And so
Yeah.
that's become my side hustle. I'm still looking for more, but
Well,
maybe not too much more, but that's a
and I
good,
think
anyway.
and I think we're going to see more of that because you and I are both employees, and physicians back in the day would go out and they'd start their own practice and hang their own shingle and kind of scratch that entrepreneur itch. And as employees, we don't always have that, and so I think it's important to at least recognize it and also try and see what, kind of like you did. You found things at work that you could do. So you didn't completely like drive yourself off the edge. And I think that's a smart way to go. So I think we have a couple.
Yeah, there's a question
Uh,
in the Q and
yeah.
A.
Do you want me to
You can
do
answer it.
which one?
It's
Okay.
so far I only see
Uh,
one. Oh no, there's someone in.
okay.
Oh, you can answer both.
Okay. Uh, I guess if it's in the chat, I can. The good Dr. Coots. How are you, sir? So yes, I do have an LLC for my side hustle. It's a publishing company, and I did just an LLC because I didn't. I wanted to provide a little bit of separation between me and the publishing side. Um, that way, if someone said, well, I followed your anesthesia made easy book and something happened, it provides some level of protection. The other thing is
I
with
didn't pass
the
my boards
LLC.
because of you.
Yeah, exactly. So the LLC also is nice because it makes it very clean. I run completely separate books, meaning it has its own checking account, its own credit card. All the money that I earn goes into the checking account. I pay all the costs associated with the publishing, and then I can, like when I go and do a talk somewhere, if it's not for honorarium, or if it is, I can run all the money through that. So it makes it really easy with the LLC to do that. And then we have another one in the Q&A. My side hustle does not pay. I'm on 4 nonprofit boards and a chair of a 10 million campaign. Is there any difference between your definition and my reality? No. Side hustles, typically people think about the money, but like I said, the money plus, you found the plus and something that brings you joy and scratches that itch of what you like to do. Oh, it just
Oh,
disappeared.
yeah, because I hit you. You were answering it, so the next one
Oh,
will come
okay,
up.
that's
But
cool.
you just go to answer.
Yeah, the one thing that I would caution you about being on the board is make sure that you have. Oh gosh, I wish I knew that. There's an insurance. There's a special type of insurance for people who are on boards, and make sure that you have that insurance, because there was a case of actually the physician on fire, Leaf. He was on a hospital board. They non-renewed somebody, made some decisions, and then he was sued personally for the decisions that were made. And here he was just like, oh, D&O insurance. Thanks, Dr. Coots. So you'll want to make sure that director and officers insurance. So you want to make sure that you have that to protect your assets, just as a thought. Indemnity. Yeah. Perfect. I mean,
All
what do you
right.
think? Other questions?
Any other
The cool
questions?
thing about side hustle, you can define it however you want to define it and what you do. There may be some people who do a side hustle that it is, it's something they enjoy doing and kind of scratches that itch and brings value to the world, which I think is pretty cool. We have directors insurance for my alumni board that I am on. Perfect. Yeah, you just whenever you kind of do things like that, you want to make sure that you have some asset protection there for the decisions you make.
It's interesting. I was just thinking in terms of like, I wonder, do people who are on the, say, the board of otolaryngology, the board of directors, I'm assuming they do have insurance, because obviously that can
Usually,
get pretty hot and heavy if you fail someone on the boards. They could
right.
say,
And
well, wait a minute,
I
who are you
think
to fail
that
me?
yeah. And most of those organizations that big have a parent company, like a CEO that kind of help that board and everything. And most of them will have that insurance. It's usually like the smaller hospitals and some of the other ones that you got to kind of watch for.
So Dr. Coots asked, does your side hustle give you tax advantages?
Tax advantage. It can in the aspect of if you have a side hustle that loses money, you can move that loss and take it over and actually offset your W-2. This isn't tax advice, but when I was starting up the company and spending money to get it started, it definitely I was able to offset that. Now, if you have a side hustle and you continue to lose money, then the IRS, I think they say after 3 years of loss, the IRS may say, well, you have a hobby, it's not a business, it's a hobby because you keep losing
Unless
money.
you're in real estate, then
Unless you're in real
you could
estate,
put
which
your
you
losses
gotta,
30 years in the future, huh?
exactly. So you just got to kind of watch that. And, I won't be retiring from anesthesia anytime soon. Don't worry. So.
Okay. Any other questions?
Let's see. Had a rental property for years. You are right.
Yeah. All right, guys. Well, I guess I'll close it out. Again, for those who are going to the meeting and want to participate in a moderate a panel, reach out to myself or Amanda. We probably won't have a meeting next month, maybe just a business meeting, but no grand rounds, and then have a grand rounds in June. Right now, we're working on a speaker, Dr. Sydney Butts, but she has not confirmed, but she said she wanted to do it. And for those of you who don't know, Dr. Sydney Butts is recently named chair of otolaryngology at SUNY Downstate. So bring her on to help celebrate. And then obviously, hope to see many of you in Dallas. Be safe until I see you then. Please email me with any questions. You should have gotten the information for your CME emailed to you by Amanda. If you haven't, just reach out to her. She can send it back to you, but you have to do it. You have to send the text tonight. It won't be any good tomorrow. All right. I hope everyone's doing well. I'm going to sign off. Thank you again, Dr. Steiner. You were awesome.
Thank you very much, Dr. Johnson. Appreciate it. Y'all have a safe night.
Bye.
Bye.